Well, thank you. Good morning, everybody. Good to see you all. Thanks for joining us today. So I just want to talk for a few minutes about vaccine availability and what we can do to really make the process go as smoothly and as efficiently as possible. So now we've seen many more people be eligible, and in 9 days, all those over age 16 will be eligible to get the vaccine, but we need to be aware that the supply we get from the state can't really keep up with the high demand. So a couple things to ask of you and ask everybody to do. Still, we've got far more people who want the vaccine every week than we have supply. And with this quick expansion of eligibility, even more people are going to be waiting in line. So we know it's frustrating, but please work with us. So there's a couple of things people can do. First is please be patient. Our goal is to vaccinate everyone in the county who wants to be vaccinated, and that goal is not going to change. It's going to take a few months to get everyone vaccinated unless we get more doses from the state. In that case, we can speed things up. We are putting in the capacity and have the capacity to deliver all the vaccine that's delivered to us. So please be patient and work with us on this. Second thing is we will continue to fight for more vaccine, and the maximum number we can get for Snohomish County Health District, get those from the state. So our mass vaccination sites are doing great work. We just haven't had enough supply to meet our maximum capacity. So we will keep asking for more. Third thing really is to try to get your vaccine through your healthcare provider or a pharmacy. Many pharmacies are getting supplies of vaccines every week directly from the federal government, not through the state. And we want to maximize our use of those vaccines every week and maximize the use of our vaccines from the county and health district standpoint. So that way we can really be most efficient here at the county level. Fourth thing really I'd ask is if you're looking for an appointment, please consider helping out any of your relatives or neighbors who may not have the technology or ability to use the online scheduling system. We know that not all people have equal access to internet, and not all people are as comfortable with it. There may be language difficulties, there may be transportation difficulties. So please think about those around you, both in your family and in your neighborhoods, and try to help somebody out that may be having difficulty with this. And finally, if you are appointment shopping for your first dose and find an earlier one somewhere else, please don't forget to cancel any later first doses you scheduled. Any appointments that are no-shows make it hard for everyone to plan. So if you make an appointment, find one that's sooner, make sure you cancel that first appointment so that there's not a vacant spot there and a vaccine waiting for you and you don't show up. So that'd be very helpful. So with that, we're going to keep focused on delivering vaccines as efficiently and quickly as we can, pushing for more vaccine, and just thank you for your cooperation on this. So with that, I'm going to hand it over to Dr. Spitters from the Snohomish Health District.
Well, thank you, Executive Summers, and good morning, everyone. I'd like to start out today by acknowledging that this is National Public Health Week, falling in the midst of a pandemic. And so just a little shift in gears today to mention that once a year in April, we recognize the discipline, the profession of public health and all the public health workers. And we may be physically distant from one another, but now it's more important than ever to at least virtually come together and try to stay unified in our approach to this and all the other health challenges we face. And that's why this year's theme for National Public Health Week is Building Bridges to Better Health. Making communities safe and healthy is public health's top priority. In the midst of the most challenging public health crisis of our lifetimes in COVID-19, I'd like to thank the entire team here at the Health District for their hard work day in and day out over the past 15 months to keep our communities safe. I'm forever grateful to this dedicated, hardworking, and flexible team here at the Health District. They are true public servants, and I couldn't do my part of the effort without them. I'd also like to acknowledge the leadership and support of our Board of Health, as well as the members of our Public Health Advisory Council and Community Equity Advisory Board. But as you can imagine, public health extends far beyond the walls of the Health District. Snohomish County Government, Department of Emergency Management, the Executive's Office, Fire, EMS, hospitals, schools, among others, have contributed greatly to our COVID response. We couldn't have made it here without them. And beyond COVID, we have partners doing routine work daily that is key to public health. Water and wastewater districts, solid waste, other public utilities, schools, healthcare providers, the list goes on, but I think you get the idea that public health is a collective activity, and we are but the government agency around which that revolves. We'll be sharing some highlights about Public Health Week on our social media channels, so I encourage you all to tune in. Before we go to COVID and talk about case rates, I have a few reminders about related items with respect to COVID prevention and control. First, travel guidance. Last Friday, CDC updated its travel guidance to announce that, one, fully vaccinated people, meaning people who are 2 weeks out from their last dose, 2 weeks or more out from their last dose, meaning second dose with the mRNA or the Johnson & Johnson, 2 weeks from that, you can resume domestic travel and do not need to get tested before or after travel or self-quarantine after travel. Having said that, I strongly encourage you to do all the other prevention methods while traveling: social distancing, face coverings, personal hygiene, avoiding gatherings. There's a lot of people traveling right now. Airports were full over the weekend, probably more full, I think, than is in our best interest. So, keep that in mind. Fully vaccinated people also do not need to get tested before leaving the country unless their destination requires that. And they don't need to self-quarantine after arriving back in the United States. Keep in mind that some businesses and locations may still require testing, and so we encourage people to know what your employer is expecting before you leave so that you can accommodate that. Your employer is allowed to be more restrictive than the public health guidelines. Vaccine updates. As shared in a press release yesterday, the Snohomish County Vaccine Task Force is opening its 6th mass vaccination site this morning. It is a drive-through site located at Boom City in Tulalip, and it is organized in partnership with Tulalip tribes. I've been told that appointments are still available for today, so if you are in need of a dose, go check it out. The other 5 sites will continue operations, though days and hours will vary based upon vaccine supply. This week, along with Boom City, the sites at Angel of the Winds Arena, Boeing Everett Activity Center, Edmonds College, and Monroe Fairgrounds are all operating. The Arlington site will not be operating at this moment because we got no Pfizer vaccine for that site, and that's our usual product for that site. When doses do become available, that site is expected to resume its operations. All of these sites are still by appointment only, including those open slots at Boom City today. So don't just go out there. Go into the state or go into PrepMod and look for the slots there. Please do not show up without an appointment in the hope of getting extra doses. We still have a much higher demand than supply of vaccine, and you will be disappointed, and it'll also kind of jam up the gears if there's people showing up without appointments. Starting this week, there's also a new waitlist feature in place for the mass vaccination sites. If you try to register for an appointment but none are available, you can sign up for a waitlist for that same day. Meaning if I go into the internet, can't find an appointment today, I can sign up for a waitlist for today. And if there is a cancellation or additional doses become available at that site on that day, people on the waitlist will be notified. The waitlist does not roll over into future days, so people will need to sign up again for the next day. It doesn't carry forward. There are also mobile teams through the task force who continue vaccinating at senior living complexes, senior centers, and shelters for those experiencing homelessness, as well as for people who are homebound, by medical necessity and cannot access vaccination from outside their home. With eligibility expanding, as Executive Summers mentioned earlier, and vaccine opening to all adults starting April 15, it's very important that we continue to ensure access to vulnerable groups. This includes our seniors who have not yet been vaccinated. If they are having trouble finding an appointment, we encourage them to call the COVID-19 call center for Snohomish County at 425-339-5278 during 8:30 a.m. to 4:30 p.m. Monday through Friday. If you know an elder adult who needs help with this, please help them make the call or go into PrepMod and see if you can help them make the appointment yourselves. Speaking of vaccine appointments, I would like to reemphasize Executive Summers' comments about being sure to cancel any extra appointments you've scheduled. This helps to ensure that as many people can get in for vaccine as quickly as possible and that we can move down the road as quickly as possible toward getting vaccine to everyone in Snohomish County who wants it. Please don't hoard appointment slots. A missed appointment is a lost opportunity for the whole community. So pick one and cancel any others you have made right away once you commit to that visit. Now, for some sobering news, I'll turn to our rising case rates. Our case rate, the 2-week rate, has gone up for the 3rd week in a row, now at 121 cases per 100,000 through the 2 weeks ending Saturday, April 3rd. We shared in Friday's press release that as of last Monday, March 29, there were 15 residents hospitalized due to COVID complications, and 3 were on mechanical ventilators. That was the lowest we got there in recent history. But just as of last Friday, 1 week later, we reported 26 hospitalized, and now we're up to 32 hospitalized as of yesterday with COVID. 3 of those folks are on ventilators. In a quick survey of recent cases and outbreaks, we found gatherings continue to be the leading contributor. Gatherings for a variety, social, faith-based, sports, etc. But gatherings and the age groups tend to run on the younger end. 40% of the cases occurring in the last 2 weeks have been ages 20 to 39, and if you add in 20 to 49, that takes you up to almost 60% of cases. So I know people are wondering how cases are rising while vaccination rates are also rising. I'll remind you that as of yesterday, 30% of the county had initiated vaccination and 18% had completed it. But as we've been sharing for weeks, we are very clearly not out of the woods. That 30% of the population with initiated vaccine, 18% completed, simply isn't a sufficient proportion to interrupt the transmission of this very difficult to contain virus. We may not see a real slowing until up to 80 or more percent of the population is fully vaccinated. So, we still have several months ahead, as Executive Summers mentioned, where we're relying on everyone to remain vigilant in wearing their masks as we continue to roll out the vaccine effort. And it's not just the mask, but avoiding gatherings, keeping that 6 feet of distance from people outside your household when you're out of the home. We'll get to a day when this is all behind us and these measures are unlikely to be necessary, but that time is still many months off. And we can enjoy all the gatherings and get-togethers and favorite pastimes, but we're just not there yet, and we won't be there tomorrow or next week or not even next month, but in a few months we will get there. So please hang on, keep trying, be patient, and we'll get there. So with that, I'd like to turn it back over to Executive Summers.
Thank you, Doctor. So if you have any questions, please enter them into the chat box and we'll try to address them as best we can. We don't have any that I'm seeing. Okay, here we go. So Doctor, probably for you, what is the outcome data once someone is on a ventilator? What is the ratio of survivors once that level of care is reached?
I think it's about a third to a half survive. It's improving over time with improved care, and use of the antiviral remdesivir and dexamethasone to decrease the inflammation in the lungs and the rest of the body that's at the core of this. But I'd say roughly a third to a half survive.
And Doctor, do you know where we are with the percentage of people 65 and older who have been vaccinated?
Yeah. Well, through March 15, 56% of older adults 65 and up had initiated vaccine, 34% had completed. It's a very challenging database to get that information from. Takes about a week of the epidemiologist's time. So we're just running that once a month. We'll run that on data through mid-April toward the end of the month. So we won't have an update for you on that figure for several weeks. What I will tell you is that through a combination of wise behavior and that vaccination coverage that I mentioned, in the last 2 weeks, only 26 cases, or 2 to 3% of the cases countywide, occurred in individuals over 70 years of age. So we've made a lot of progress there. And now our goal is to, fan that progress out to younger age groups.
Okay, next question. Any concerns if trends continue that we'll move back into phase 2? And say I'm extremely concerned that we are headed in the wrong direction with our case numbers, and if current trends continue, there is a danger we will be moved back into phase 2, and that would be bad news for our businesses and our communities. So please continue to wear masks, distance. It's critical for the coming months that we really take those protection measures that we've been practicing for the last year and continue them strongly, or we are going to be back in phase 2 very shortly. King County is even closer than we are in terms of their numbers. I believe the number is 200 cases per 100,000, and we're headed in that direction. Doctor, would you like to address this also?
Forgive me, Executive Summers. I was reading one of the questions and I missed the prompt.
It was just any concerns if trends continue that we'll move back into phase 2.
Yeah, most definitely. I mean, look at the line. That's I'm with you. That's where we're going, and I'm concerned on 2 levels. One is the illness, suffering, hospitalizations. We might have fewer deaths and fewer hospitalizations because of the younger age impact, but it's still bad for people's health. Again, a third of people that get COVID 3 to 6 months later still have trouble breathing, have a foggy brain, don't feel good. So it's, even if you don't get hospitalized, this is not a benign thing. So on the health front, that's clear. And then if we have to retreat, the economy again, that's just hard on everyone. So please we all need to do our best to try to bend this curve back down.
And the next question was, with the study out of Minnesota showing a rise in variants spread among children, what is the level of concern with children returning to in-person learning?
Well, one, we're getting or have gotten the school teachers vaccinated. Incidence of severe disease in children, although not zero, is very rare. So, is there concern? Sure. I mean, we want less disease, whatever the age, not more. So that is yet another prompt that we need to, keep our guard up all around, including the kids in schools. And frankly, the Snohomish County schools are doing an outstanding job of, following all the guidance and working with us when cases occur. So although, that the variants might increase the risk of kids getting it in the community and bringing it into the school, at this point, it's not something that's going to derail our effort to get the kids educated on site. But it just speaks to the importance of all those efforts to prevent and control transmission.
So, Doctor, with the new variant that's more contagious, is it proving more dangerous or just more likely to cause symptoms?
Well, it really depends on which variant you're talking about. The B.1.1.7 variant from the United Kingdom or that's where it was first at least detected. That has a slightly increased risk of death. It appears, just looking at the data. These are not experimental studies following individuals. It's just looking at the overall data, and it appears that the mortality rate in those cases is just a little bit higher. Still very low. We're looking at like 4% versus 2% or something like that. But still, higher. And then some of the other variants, the dominant ones in the community, like the B1429, which is expanding rapidly and is now, I think, the largest proportion of at least cases sampled by the state. That one doesn't appear to have greater severity, just it's more transmissible. So each one has its challenges, but some of them do carry increased severity, but all of them appear to be a little bit more slippery and harder to control. And that's the key thing, and why we really, now is not a good time to be having gatherings or letting the masks off.
I've heard that the good news is that the vaccines appear to be effective against the varieties that we've seen so far. Is that the case?
It's exactly right, Executive Summers. Although there's some reduced strength of the reaction between the virus and antibodies from recovered cases, or antibodies from people who have been vaccinated, and then they take their antibodies and they put them in a test tube with these variants. Our antibodies are a little bit weaker than they were for the previous strains, but they're still good enough in the human body, in the community, to prevent severe disease, reduce transmission. And so we still have this window of opportunity in this race to, outrun this virus and really try to push levels down, both with our behavior and getting the vaccine rolled out.
And just to clarify, we confirmed the UK variety in Snohomish County, and what is it doing to younger people, really, and any more discussion on the potential impact on schools?
Yeah. Well, again, these are the state sampled in March about 10% of positive specimens, and did the gene sequencing on that 10%. And so that's not it's not a random selection. It's not what we call a representative sample that gives us a really accurate estimate of what's going on community wide. But it's what we call a convenient sample. It's specimens from labs that are cooperating, and that the state takes them in and works on those. And of those, about 4% now were B117, up from less than 1% back in January, February. So that is expanding, but it's still not a substantial proportion of cases. It will carry with it, especially in older adults, it appears, greater severity, but no impact on vaccine efficacy. And I think it's unlikely to, although it may transmit among all of us, regardless of age, more efficiently than the previous strains. Because kids are already at very low risk for severe disease, I think it's unlikely to have a measurable impact on that, at least in the small numbers of cases that we see locally.
My concern with the schools and the new variants is that kids bring things home from school, and although schools are doing a great job in keeping kids apart and distancing, there's always the increased chance from people together of spreading that and then bringing it home. So families need to recognize that even though children may be at low health risk, they can still bring it in and infect somebody who's more vulnerable, a parent or sibling or grandparent or somebody else. So we just really need to stay vigilant and keep wearing masks and socially distance and all those things. But that's a concern I have with the new variants.
Absolutely, absolutely. And at home, although children, the epidemiologic data suggests that in the school setting and in the community where kind of things are under control, right? Kids are spread out, they're wearing masks, contact is transient and short term. kids aren't really the generators of the kind of, clouds of aerosols that make them efficient transmitters in that setting. But when you're living with them and you're sharing the kitchen and the bathroom and they're on your lap and you're playing and talking and there's no masks, the risk in the home is indeed much higher. So kids do bring things home, and there is that risk.
Okay. So if you're vaccinated, are you free from fear of being infected, or is the 95% efficacy, should that leave you feeling vulnerable, if only slightly?
Well, fear is an emotional reaction to a circumstance. And so that's the level of fear is going to vary with each individual. And for some folks, even being vaccinated fully or getting further down the road and having fewer cases, many people will still suffer from fear of COVID. I think that's a real thing that's going on in our world right now. But speaking objectively, all I can say is that in real world practice, that 95% figure is from the studies. We're seeing more and more publications from real world settings where it looks like one dose of the mRNA gets you about 80% protection. 1 to 2 weeks after you've gotten that first dose, you're kind of 80% protected. The second dose clicks you up to 90% about a week or two after that second dose. And from there, I mean, you do the math. You still got, it's not like you have a 1 in 10 chance of getting COVID now. It's just that your chance is 1/10 of what it was without vaccination. So there's still some residual risk. And especially with these circulating variants, our tolerance as a community for further transmission, I think is and ought to be very low. And so although you might say sort of the cost effectiveness of prevention measures might go down for the individual after they've completed vaccination. And I don't think I think that there should be some reduction in fear of acquiring the infection. That shouldn't change our behavior because we really, kind of need to have a zero tolerance right now to turn things around and hold the virus at bay until we can get enough people vaccinated to where it really is safe for the community to let its guard down. And so we all need to chip in, even those of us who are vaccinated. And there you have it.
How is the supply level doing for Pfizer, and is that still the only vaccine approved for those 16 to 18 years of age? And any news or information on emergency use of a vaccine for kids under the age of 16?
Okay, so 3 questions there. The Pfizer supply is, for this coming week, it's probably the least of the 3 products coming to town. Um, uh, and that's just, we don't control things at that level. The state is getting its per capita allocation of total doses from the government or from the federal government. And so I assume that's a manufacturing distribution issue. Moderna and Janssen & Janssen are kind of the leading products this week. We've got 32,000 doses coming through the regular state allotment to the county, with about um, 1/4 of those being the single dose, 1/4 being second doses of the mRNA vaccines, and 1/4 being first doses of the mRNA vaccines in gross terms. And so now the Pfizer vaccine is, yes, it's the only one indicated for people 16 and up. All the others are indicated for individuals 18 and up. And the studies in kids are in adolescents, I think, are approaching a point where the manufacturer, at least Pfizer, is probably going to be launching an application for emergency use authorization for that vaccine for adolescents. But the studies are still ongoing for younger children. And so that's to be determined. Probably the soonest we'd see adolescent vaccine, I'm guessing a couple of months, and younger kids probably many, many months. Hopefully we're far down the road in terms of raising vaccination coverage in adults and lowering rates in the community. And respectfully so, but I think at that point, vaccinating the kids is kind of a mopping up thing of the initial emergency response, and then we'll take it from there.
Okay. I think you mentioned we're getting 30,000 doses this week. Do we know about the pharmacy program?
No, we get that information a week after, just the way the information flows from the federal government. We don't have as much real-time visibility on that, but it's been running 12, 15,000 doses a week. So I assume, so 32,000 through the regular channels. I suspect 45,000-ish once the federal retail pharmacy program gets counted in. We get that information next week. You'll see that information for last week pop up on our website table that shows vaccine allocations. So last week's figure from 22,000 will be updated, and you'll see a new figure there later this week that's a little bit bigger for last week. Just like next week, you'll see that the 32,000 became 40 some odd thousand.
And Dr. Spitters, what's your advice for people who aren't vaccinated but are living with people who are vaccinated and have vaccinated friends? What should the unvaccinated be doing to protect themselves if they get together with the vaccinated or partially vaccinated households and friends?
So the guidance on that is that if two fully vaccinated people meet indoors, they can meet without wearing face coverings, etc. All right. If a vaccinated person is with an unvaccinated person, and that unvaccinated person is not at high risk for severe disease, meaning advanced age, underlying medical conditions, etc., they're a healthy young adult. The rules from CDC permit you to dispense with the masks and the social distancing. I would tend to still do it. I'm a more cautious person. And then certainly people who are meeting with unvaccinated individuals, when two unvaccinated individuals meet, then, all the rules are still on. So I think the real judgment call for individuals to make is when a vaccinated person is meeting with an unvaccinated one. And although the rules permit me to not wear a mask as a vaccinated person with those who are unvaccinated, I just think it makes more sense to err on the side of caution. It's just not that big a deal to keep the mask on and stay 6 feet away. And so that's my recommendation.
Do you have concerns about the 2-week mark after Easter? And is there any plan to address a high rate of hospitalizations if Easter activity ends up causing a spike?
Well, yes, that's what we've been saying. I mean, it may or may not be the Easter holiday itself, although that certainly generates lots of family and social gatherings and faith-based gatherings, any of which could be super spreading event or at least sustain the chain of transmission. So, of course, we're concerned about that, and that's why we're pleading with folks. We really gotta ratchet our interactions and down a bit because the nature's telling us that the current level is too much. And if we continue, it'll keep going up. And then not only will we suffer in health terms, but also all the branching consequences of having to retreat in the phases.
Just say we were already headed in the wrong direction. We're seeing increased case counts before the Easter holiday, and adding that on top of it, I think we're likely to see increased cases. But we will do everything we can, and I know the healthcare providers are watching the numbers also and making appropriate plans. Doctor, do you have any thoughts on the double mutant variant that was recently found in California that has 2 mutations in its genetic composition?
I'll have to look up what you're referring to. I'm sorry. Just to mention that most of these variants have a numerous mutations. It's not just a single mutation. They might have a key one that's particularly problematic in changing the gene changes by a click, and then the protein that it makes is changed, and then that's the problem that it then grabs onto the human cell better, or can evade immunity a little better with that change in shape. And so, more mutations generally not good, but many of these have multiple mutations already. So I'll just have to check out what you're referring to and get back to you.
How much of a forecast is the health district getting from the state in regards of vaccine supply? State puts out their 3-week schedule, but is the county getting a more individual forecast?
Yeah, we do get a 3-week lead time, and the forecast is generally more or less our per capita proportion of the state total. So roughly 10 to 11% of the state's doses are forecast to come to us in the next 3 weeks, and currently that's a stable amount. That's roughly in the mid 400,000 doses at the state level, meaning 40 some odd thousand doses to us, which is kind of the numbers I was discussing today. So absent a bump, which we're all hoping for, as Executive Summers was mentioning in his remarks, supply is so key to the speed of our progress. But for right now, at least for the next 3 weeks, it looks like we're going to be at about the same pace of roughly 40 to 50,000 doses a week coming into the county.
Any question? If, when, or if ever, do you think the county will start vaccinating its maximum capacity? And I'll just start on this. I don't think we will reach our maximum capacity. Our goal has been to have more capacity to deliver vaccine than we have vaccine, and we want to lean forward on that and stay in front of that. So any increase of vaccine that we get, we're able to handle quickly and efficiently. So we've made provisions for even more clinics and more opportunities for people to get vaccines that we can stand up. So I do not expect we're going to max out our capacity. Doctor, do you have anything to add to that?
I share that, and just I'm grateful and really impressed by all the work that's been done by DEM, Fire and EMS, working with us and other partners to build that capacity so that when vaccine comes, we can put it out. I don't know that any county has this much per capita mass vaccination capacity, and I think that's really serving us well. And I just hope we get more and more vaccine to fill up that capacity.
Yeah, I think the last question is, Snohomish County able to make any forecasts when the entire county will be covered? Short of that, is there any expectation when a more reliable estimate on coming doses and the increase in the numbers of doses? Doctor, I think you shared some information on this last time.
Right, we've shared a couple of times that at the current pace, we would likely vaccinate about 80 to 90% of adults by the fall, roughly sometime between August and October, probably more toward October. And that's the current timeline. If things really speed up, let's say we had a doubling of vaccine supply, with this big capacity we have, we could probably get it done. If we doubled supply, we could probably get it done in almost half the time. If things were to slow down for some reason, if we went back to the level we were at, say, a month ago with 25,000 doses a week, we would, if we had continued at that pace, we wouldn't have gotten to that level till the end of the year, maybe even into the beginning of next year. So I think, right now we've got a lot of demand, a lot of interested people. We're begging their patience and staying in the game. Don't give up, be patient, and keep going up to bat to try to get that spot. Cancel any extra appointments you've made. And then a time is going to come where, we've reached 70, 80% of the adult population. And I suspect then we're going to be here trying to encourage people to help us finish this off. So again, let's try to get everybody in there and wait our place in line, do our best, and try to get this done as quickly as possible.
That wraps us up.
This is Kristen in the Joint Information Center. Thank you for joining us today. Please stay tuned for future media availabilities.